I'm Dr. O'Donovan.
And I'm Ella, a physiotherapist.
And in today's video, we're going to go over exercises you can do at home to help with knee pain.
So what we're going to do is go into the lying down position. So we're lying down onto our back. And basically, one leg at a time, we're just going to grasp the knee just below the kneecap, and we're going to pull it as far as we can so that the knee is touching as close to the chest as possible. Try and point the toes just to make it feel a bit more comfortable. Hold this stretch here for around 10 to 30 seconds again, and you should feel it in the lower bit of the leg and then also below the glute of the leg that you're pushing in towards your chest. Once we've held it here for around 10 to 30 seconds, we're going to slowly release the leg and drop it down into the lying position. And again, we're going to swap sides and bring the opposite knee towards the chest, using the overpressure from the hands, and try and pull the knee towards the chest. Again, you should feel the stretch in the lower bit of the hamstring, so that's just behind your thigh, and then again in the glute of that side of the leg.
That's great, I can definitely feel it.
Yeah, it's a really nice stretch. Now pause the video and do this number of reps. You're just going to sit on the floor with the legs in an extended position. And I'm going to show you two variations of this exercise because some people find it quite difficult to know how to do the first variation. So working one leg at a time, basically what we're going to do is try and squeeze the muscles of the thigh one leg at a time, and we're going to effectively try and push the kneecap into the floor below you by squeezing this thigh muscle. So you won't see much going on, but it's just inside what we're trying to do to the thigh muscle. So squeezing that kneecap, and the heel should lift off the floor a little bit. And again, try and hold that for around 10 seconds. 5 to 10 seconds before releasing down, relaxing the leg. And you should feel that this muscle is coming towards the body on the thigh, and the knee should be trying to push down into the floor below you.
And keeping this opposite leg relaxed.
Just relaxed, yeah. So we're going to do one leg at a time and then switch to the other side. Knee into the floor. If you find this difficult, we can use equipment. You can use a toilet roll at home, a rolled up towel, and we're just going to put that beneath the knee. So the knee's in a bit more of a bent position. And again, we're going to squeeze the thigh muscle so that the heel comes off the floor. And you should feel the thigh really tight and contracted.
And just to check, Ella, with my foot, is that in the right position?
Yeah, so the ankle, knee and hip should all be in a line. So try not to bend it out to the side. Try and keep it in front of you, and then just keeping the eye line at the toe.
And again, you'd probably repeat this exercise about 5-6 times on each leg?
Yeah, 5-6 times on each leg. So if you've got a bit of a ball underneath the leg, I'd say do it on the right leg first, whichever the equipment's under, and then complete on the left side.
Perfect.
So just aiming to lift the heel off the floor by squeezing the thigh muscle and lower down.
Now pause the video and complete this number of reps.
So next one, we've got a straight leg raise. So again, we're going to work alternatively, one leg at a time. So if you're at home, you can just go into the quarter line position with putting your arms behind you. Or if you're in hospital, you can set the bed to about quarter line position. And from here, we're just going to keep both legs extended, hip width apart, pointing the toes towards the wall in front of you, and extend one leg up at a time, trying to keep that leg straight. Hold it for about 3 seconds before lowering down. And then we're going to do it on the other side.
And I guess the key thing here is the control, right?
Yeah, the control. So it's not a kicking, jerking movement. It's more of a controlled movement with the hip. Just working the muscles at the front of the hip here. Before lowering down. Perfect. Now pause the video and do this number of reps. So next exercise we've got is a leg squeeze. Again, we can use a bit of equipment to make it a little bit easier. So we're going to use a ball or a toilet roll, a towel, anything that you've got at home. Placing it between the legs, so just between the kneecaps. And again, ankles should be in line with the hips and the knees, and we're aiming to squeeze the ball as hard as we can, just so that the knees pointing inwards and holding this for around 5 to 10 seconds. You should feel it on the inner bits of the top of the leg, the inner thighs, before releasing that squeeze. And then again, squeezing the ball. And releasing. You should see a bit of a leg shake because of that, how hard it is. Definitely. And then squeeze the ball, keeping that chest looking forwards, and then relax.
Now pause the video and complete this number of reps.
So the next one we've got is a sit to stand, and effectively what we're going to do is aim towards sitting on the bench behind you.
Okay.
It's going to be harder the lower the bench is behind you.
Okay.
So just be careful if you feel like you're not sturdy enough or stable enough to go into a lower seated position, then just try and find a surface that's a bit higher.
Right.
So what we're going to do is go into the standing position, legs hip width apart, and we're just going to push the bum back all the way to the surface behind you. Relax down into the seated position, and then we're going to stand up from the box, moving the torso forwards before extending all the way in the top. And you're really going to feel it in your bum and the tops of your thighs here.
Okay.
So sitting down, try and control it. So we want around a 3-second descent.
Okay.
And then again, we can stand up a bit quicker if we like. But again, the key thing with this is if you don't feel comfortable enough or safe enough, perhaps do this exercise next to a wall so there's something to hold on to. And there's nothing around you that you can fall or trip onto. So now pause the video and do this number of reps. Okay, so the next one we've got is the simple step up on a step. So what you can do is do this on the stairs at home, just on the bottom step. Again, if you feel like safety is, if you feel that your stability, if you feel unbalanced, you can hold a banister.
Okay.
And what we're going to do is just step onto the bottom step, one leg at a time. So stepping onto the step and then extending through that forward foot until we're in the standing position. And then again, we're going to move back and step down off the stair.
Okay. And obviously, the lower the step, the easier it will be because there's like less movement, right?
Yeah.
Okay.
So if you want to progress, you can add another box onto the stair or do the second step at a time.
And how slowly should I be doing this, Ella? Should I be like moving through it pretty quickly, or should I be going as slow as possible?
So I'd say to keep it nice and controlled, because if we're just going to go really fast, you're not really working on your muscles. You want to keep that time under tension. So the slower the movement, the better, really.
Right.
And we're going to lead with each leg, opposite leg at a time. So we're going to change legs in the bottom position.
Okay.
So first we're going to lead with the right foot, and then we're going to lead with the left. Keeping that chest and head forwards, trying not to arch the spine.
Now pause the video and complete this number of reps.
So the next one we've got is a partial squat.
Okay.
So here it's going to be like a bodyweight squat, but we're going to hold onto a surface just to make sure that we're nice and stable. And we're effectively going to go into a bit of a half squat. So pushing the bum back about halfway, just so the knees are in line with the toes, holding it here for around 3 seconds before extending up into a standing position. James is holding a surface just to offset some of the weight from his legs. So his is a bit of the regressed version, but for me, I'm just going to stand without something to hold and follow James's movements. Again, we can just put our arms wherever we feel most comfortable. It may feel more comfortable to keep the toes at 10 to 2 position.
So slightly turned out, right?
Yeah, slightly turned out.
And my feet are about hip distance apart?
Yeah, so it's wherever you feel most comfortable. Mine is slightly wider than hip width apart.
Okay.
You may feel a bit more comfortable in that position.
Yeah, that seems to give me a little bit more stability.
And again, once we carry on doing the reps, you should feel it in your upper thighs and in your bum. Now pause the video and do this number of reps. We've got his bodyweight squats.
Yeah.
So we're just going to keep the toes a bit further than hip width apart.
Okay.
And just squatting down as if you're going to sit on something behind you.
Okay, and hands, should they just be in front of me?
Wherever comfortable, so in front of you, across the chest or down below. And then we're going to hold it in the bottom position for around 3 to 5 seconds before extending up into the standing position. So we're going to try with our hands crossed over our chest. Again, try and keep the eye line forward so that we're not arching over or looking up at the ceiling, because you're just going to feel more off balanced. And try and do 5 to 10 reps of these. If you feel like it's quite difficult to get in that lower position, do a bit of a wider stance and turn your toes outwards. You may find that's a little bit easier.
And should I avoid my knees coming inwards? Do I want to keep them out or like in line?
Yes, that's a perfect point. So in the bodyweight squat, try not to let your knees collapse inwards or outwards at the same time.
Okay.
Try and keep, in the lower phase of the movement, try and keep the knees in line with the ankles so that we're shooting lasers that are parallel to our toes.
Okay.
Before extending up.
Now pause the video and complete this number of reps.